Well, hey there, pharmacy owners. If you're getting in on the weight loss kind of revolution of intensity around GLP-1s and you're dispensing GLP-1s, you might have this question that a lot of my members have had recently is, how do I know whether to carry sublingual? Do I carry the injection? How do I help patients decide about, which one is which is better for them? So I thought I'd talk a little bit about the differences between the sublingual version and the injection version. Now, the standard kind of normal is injection because that's what the commercially available product is. And you might be thinking, well, I'm not a sterile compounding pharmacy, so I don't do sterile. Absolutely a-okay. A lot of people can still offer the sterile solutions either through reselling 503Bs or by partnering with the 503A in their local state. So even if you're not a sterile compounding pharmacy, you can still, usually there's a way to be able to still offer a sterile injection option. Now, the sterile injection is the gold standard. Any other dosage form other than injection is just not going to be anywhere near as effective. Like, let's just lay that out there. You're going to get, a better per milligram per dollar effect with an injection. That does not mean that other dosage forms are not effective. They're just never going to be quite as good as the injection. But some people just are never going to inject themselves. You're going to have patients that are just absolutely against any sort of injection, no matter if it's going to make them beautiful and skinny and healthy. They just aren't going to inject themselves. And so sometimes it's not a good fit. Sometimes it might not be a good fit for other reasons. So it's good. I think it's always good to be able to offer choices that solve different problems. So offering a non-sterile version like the sublingual version can be great. More pharmacies can compound the sublingual version. Virtually any pharmacy can compound the sublingual version. Obviously, you got to follow all your compounding rules and guidelines. And because it's non-sterile and you can buy the product, you can buy a pre-made sublingual solution, or you can make your own. I'm a big fan of making your own. One, it's lower cost. Two, you can control the flavor. You can control the viscosity. Actually, on my training call earlier today with my members, one of the members like, my patients can't stand the flavor of the pre-made solution. So I let her know that she can compound her own sublingual solution. And not only will you be able to have control over things like the flavor and the viscosity, but you'll also save money. So woohoo, win-win, right? So when is it appropriate to offer the sublingual? I say if you can do it and you can offer it, like, go for it. And if you're not a compounding pharmacy, there's even 503As that will compound the sublingual for you. So I think every pharmacy has the opportunity to get in on the GLP-1, semaglutide, tirzepatide kind of weight loss craze that's going on. Every pharmacy should be able to help their community and support their patients on their journey of weight loss, no matter what, whether you're compounding, non-compounding, you can offer solutions for that, whether it's by partnering with other pharmacies like a 503B or 503A, or just providing support. We have several members that charge $47 a month for a support-only program. So they provide a Facebook group, they provide Zoom calls, they provide some local dining out guides. There's a way for them to submit questions, like just support for patients, because a lot of places just will sell the stuff. And we all know that just the stuff is often not good enough. You kind of need some other hand holding in that. So back to injection versus sublingual. If you have a patient who wants the biggest bang for their buck, they're not afraid to inject, they're more than willing to inject themselves, then I say just go straight with the injection. That's kind of the quote unquote proven. That's certainly what was FDA approved in the commercial product, was the injection. Very clear dosing, very clear expectations of what that's going to produce. However, if you have somebody who just can't afford the injection, they're just anti-injection, they're scared, whatever, then a sublingual is a really great alternative. The sublingual can still cost a good amount of money. Obviously, a little bit depends on how you, the pharmacy, make it. I'm a big fan of making it more concentrated. That way you use less volume. Not only will less volume cost you less and reduce the cost of the prescription, but less volume is also easier to hold in the mouth. Now, for somebody who maybe has very particular texture and taste sensitivities, sublingual may not be a good choice. It's a very thick liquid. You're supposed to hold it in your mouth for 10 minutes, which is very hard to do, actually. And so if they have some of those kind of like EBGBs about oral stuff, then maybe that might not be a good choice for them. I think in a perfect world, the regimen would go, patient would go on the injection, they would lose weight, and as they're getting to their goal weight and switching to maintenance mode, they would get off the injection and go on the sublingual. I think that's just the best use case of all of them, but we live in a real world where best use cases don't exist. So I think putting patients on sublingual to lose weight is perfectly fine. I think we've realized in the few months since sublingual's been a thing that we got to get more aggressive with the dosing. When it first came out for semaglutide, common dosing was 0.25 milligrams a day, or maybe even 3 times a week. And, kind of stay at that dosing for 4 weeks and then you increase. I think we're realizing that really 0.5 milligrams is a good place to start for sublingual semaglutide on a daily basis, or you can convert that to a 3 times a week dose. And really, it's probably going to be closer to that 1 milligram a day dose equivalent there, the semaglutide, for really the weight loss that most patients are looking for. Some patients are having to go up a little higher, certainly to 2 milligrams, have seen that. But really that big weight loss, the effects where people feel full, they kind of get rid of that food noise trash that's in their head. I really start to see that around that 1 milligram a day for that sublingual dosing, which is definitely a little bit more aggressive when it first came out. So if you have sublingual patients, and you got 30-40% that just aren't responding, chances are it's either one, they're not holding it in their mouth long enough, and you really need to not only ask them do you hold it in your mouth for 10 minutes, but ask them, how do you know you do it for 10 minutes? Are you just guessing at 10 minutes? Are you, putting on a timer? Are you doing something else that takes 10 minutes? So really hound them on making sure they're keeping it in their mouth for 10 minutes. And then second of all, that dose might need to be increased a little more rapidly than maybe originally thought. So again, I like to start at the 0.5, just make sure they don't have any weird reactions to it, and then very quickly go to the 1 milligram dose. That's just what I've seen to be very effective. Then patients start to feel that fullness. They start to, feel all the effects of the semaglutide at that 1 milligram daily dose. So just some ideas of kind of the contrast. Should your pharmacy offer both? I had this conversation with a member yesterday, and I think yes, if you can, I think you can offer both. All you do is make your piece of the pie bigger. You don't force patients to choose one, or maybe choose not at all if you're not offering one of the options. So I think offering both is a-okay, and I think you can successfully offer both. Some patients are going to be comfortable with one, and others might go between the two. And I've seen that as well. I've seen patients do injection for a while, go back to sublingual. And so you're just able to accommodate that patient on their journey, which I think is all what independent pharmacy is about, is being able to be there for our patients in the way that they need them. So I hope that helps, maybe just give you some thinking points between the two. If you have any questions about this, never hesitate to reach out to me. I'm Dr. Lisa Faast at DiversifyRx. I'm a pharmacy owner as well. Happy to answer any all questions about peptides or running a pharmacy business, understanding how to make money in this industry. That is certainly, I'm all about that. So feel free to pop your questions down below or reach out to me on social media, and I'm happy to help in any way. So good luck to you and your patients on their GLP-1 journeys.